I frequently get asked, what is a facelift or neck lift? With these types of things, patients that come in with heaviness in the neolabial folds and the nasolabial folds along the jawline, excess skin in the neck or the submental area, a facelift or neck lift is used to help improve the contours of that jawline, neckline, and around the areas of the face. Now, at our office, we typically consider both the neck lift and facelift to be about the same as far as the category of type of procedure that we're going to use to treat those things. When we treat the neck, we need to treat the face. When we treat the face, we need to treat the neck. And with that, we're going to be able to get the most balanced and natural looking results for our patients. How we accomplish that, we use a deep plane facelift technique, which allows us to address the jawline, allows us to address the neckline, and provide the most longest lasting and most natural and beautiful result that is available. We use proprietary techniques that we developed over the course of hundreds and thousands of these types of procedures in order to allow our patients to experience what I like to say is our premium product, which is the sand lift. We make strategic incisions that go behind the hairline that tuck around the ear in a near invisible fashion. And we access the parts of the face that we're trying to adjust, i.e., the deep plane, get in there, tighten the muscles, remove fat, tighten the skin in order to achieve the results that we're looking for. The incisions themselves are strategically placed such that they heal to near invisibility. With this, we're putting in suspension sutures that help provide the tightening. We're excising skin, removing fat, and getting everything done artistically, but also naturally and providing that natural, beautiful result that we like to have here. And for our patients that come in looking tired, that no matter how much sleep they get, they still feel like they look like they're not rested, or they just downright feel like they look old. For patients that have these types of feelings about themselves and they look at themselves in the mirror, facelift procedure can help reverse a lot of those changes, can help make somebody look more refreshed, make somebody look less tired, and make somebody look like themselves. I think a lot of comments that we get from our patients are they see themselves in pictures from 20 years prior, and they feel like they look much more akin to that than they did the day before surgery. I think in discussing complications, there's the four main sort of complications that accompany any surgery. And I think that it's good to couch this particular procedure in those. And number one would be bleeding. With that, we're very meticulous in terms of how we do the procedure. We have people wear different dressings and have them ice and do a variety of things that help with both the bleeding and the bruising. The risks of actual bleeding are actually quite low, but a lot of patients do end up with a little bit of bruising, which would be a part of it. Infection is extremely rare with these types of procedures. We typically give some antibiotics around the time of surgery, but it's be very rare for anybody to get any type of an infection after this. Scarring. So certainly areas where we make the incisions, people often have little tiny white lines surrounding those scars, but more aggressive scarring is very uncommon with this type of procedure. Numbness or nerve damage is probably the other thing, is the other more common complication that people talk about. Certainly, people have some numbness around the skin, especially around the ears. That can take a few months for it to come back. One of the more worrisome symptoms that people talk about or complications that people talk about would be nerve damage to the nerves that control the facial motion. And those types of complications would be exceedingly rare using today's techniques. We actually have a printed manual for the recovery process for our patients that goes day by day over what to expect during the acute phases of recovery and the subacute phases of recovery. Typically, we would see that for the first 3 to 5 days, people are doing a lot of icing. They're really trying to relax. There might be some bruising that we would expect. They're putting some ointments on the incision lines and helping with the general recovery. After about 7 to 10 days, we've removed pretty much all of the sutures that were placed. A lot of the swelling has reduced to near nothing. Patients do have maybe a touch of bruising that might be camouflaged with a little bit of makeup if it's still there. Typically, after 2 to 3 weeks, most patients are back to most everything that they're doing normally, and the recovery is fully underway. Usually, we recommend about 6 weeks before an event or some other type of party or something that the patient is planning on going to allow full recovery before they go to that event. And if you're interested in learning more about this procedure, scheduling a consultation, please go to our website at sandplasticsurgery.com or give us a call at our office 509-324-2980.